When we come to heat mold the orthotic, the first thing we need to do is to make sure that we get the correct size. And for the 3/4 length, it's a very easy process. We take the foot and we place the orthotic on the plantar surface of the foot, comfortably into the heel portion, hold the orthotic up, and we check the distal edge. The distal edge should finish 5 to 10 millimeters behind the bisection of the first metatarsal phalangeal joint, which is where my finger is. So this is a medium, which is perfect for this patient. When we come to heat the product, first of all, we have the patient sitting. We take off their shoes. We get the orthotic of choice, which in this case is a regular blue orthotic for an everyday footwear. To actually heat the product, we're going to be applying heat to the base of the orthotic along the thermal indicator. And we can do that in two ways. We can either place the orthotic on a heat-resistant surface, and this is concrete, which is fine, not on nylon carpets or wooden surfaces that can be affected by heat. Or alternatively, we can hold the distal edge of the orthotic, and in pointing the heat gun away from the finger towards the mid to region of the orthotic, we can heat the orthotic from 10 to 15 centimeters away. And basically what we're looking for is to get the thermal indicator here, the marking on the base of the orthotic, to disappear. Once it's disappeared, we've reached the correct temperature, which is around 90 degrees centigrade. Heating just this base section here means there's no transference of heat onto the dorsal surface. Therefore, the patient won't feel any heat or will not be affected by that. For the heat molding procedure, we have the patient sitting, non-weight bearing. We then take 1 foot at a time, heat the orthotic, place the orthotic into the shoe. We then place the patient's foot into that shoe while they're sitting down. Then we put the patient in the sub-talar neutral using the talar-navicular technique. We maintain that position and have the patient stand and weight bear into the orthotic. The idea of this is that if the patient doesn't require the full 6 degrees of control that's intrinsic within the device, say they only require 4 or 5 degrees, they will crush out the 1 or 2 degrees that they don't require, thereby customizing the rear foot control to this patient's subtalar neutral position. To heat the product, we'll take the gun, place the product on a heat-resistant surface. There's 2 speeds on this heat gun. We'll start off with the low, increase it to the high, being very careful as this is a heat gun and in fact can burn paint off of surfaces. But we need just to get the heat into this orthotic as quickly as possible. And then with a waving motion over the orthotic, along the midsection, and then applying the heat between the 2 shock-absorbing regions here in a waving motion. What happens is what we see, well, the indentations on the bottom of the orthotic will start to disappear, and this is the indication that we're applying heat into the device itself. We are now at a heat molding temperature. We safely put the gun down. We then apply the orthotic into the patient's shoe, firmly in the back. Holding in the distal arch area, we have the patient place their foot into the shoe, making sure that it's comfortably in the heel cup. You can either lace or not. It doesn't really matter, but we'll lace the shoes in this instance. We then take the patient and we place them into subtalar neutral, talar navicular position, and then we have the patient stand in this position. So stand with weight on both feet evenly. The important thing is that we maintain the neutral position, because if the patient pronates here, they will crush out the control in the device. So we maintain that position by cupping them in the heel, and then we push down through the forefoot to get the lie of the shoe and pull up into the arch area, cupping the heel cup. And then, in still controlling the patient, we ask them to sit for us. And it's important that we maintain the subtalar neutral position when the patient sits, because they will want to sit, bring their knees together, which means they'll pronate. So we don't leave them to their own devices. We control them from the second that they stand to the second that they sit back down again. Then we can loosen the shoe, take the shoe off. We can then remove the orthotic, place it to cool for around 5 minutes while we do the other one. In this demonstration, we're going to show the fitting of a full-length orthotic, which is normally designed to go into a sports shoe, a running shoe, or a work-type boot. Pretty much it's the same format. The important thing to remember is that whatever you have or whatever insole is already in the product that you're going to be fitting the orthotic to, you must remove this product first. That's very important. We must have as firm a base as possible to fit the orthotic onto to give us maximum control. If you have a shock absorber underneath or any shock absorbing material underneath the orthotic, it will allow it to roll in or tip inwards when the foot is pronating. So we need to eliminate that excess pronation. So we need to remove any insole that's underneath the orthotic. The good thing about removing it is it makes sizing very easy. We use the existing insole. We apply it to the base of the orthotic that we've chosen, and in this case it's a medium size, which is going to fit perfectly into the shoe, so there's no need to trim. If we do need to trim, if this was, say, shorter, we would offer the device up underneath, take a pair of scissors, and we would trim around the toe box area to get the exact fit.